So, as I mentioned in the introduction, these two papers that have come out in the last few weeks, which have looked at neutering effects, assisting decision making on age of neutering. The first one was on 35 breeds of dogs. And up until then, we've had the odd paper with the odd breed telling us a little bit about neutering and the effects. And then the second paper that came out literally, I think it was last week, where you went that extra step, which is and addressed a question which a lot of people want to know about, is sort of, well, not all dogs are pedigree. So how do you know about this for the non-pedigree dogs? So you looked at it in relation to size of dog, looking at 5 different size of dogs: small, medium, standard, large, and giant. And I will post on the podcast site links to the papers because they are open access, so anybody can read them. And I noticed in the mixed breed paper, there's a lovely little table there that gives sort of a little tick box saying, you know, perhaps when you need to think about is the best age to neuter the different size dogs. And the first paper on the 35 breeds has had over 150,000 hits already. You know, that is superstar status in the science world, you know, things like that. In fact, the thing I noticed that in the journal's history, there's only one paper that has had more hits than that, and that was published a few years ago. Yeah. And that's a paper on cannabis use in dogs. Maybe that says something about scientists and their interest in the general public. But anyway, let's talk about that work, because I understand, you know, this is the culmination of many years of work. You've always been interested in differences in breeds. Can you tell me a little bit about how that work came about?
Yeah, well, Daniel, the popularity of that paper illustrates the interest that dog owners have in that question. And
people care about their dogs.
Yeah.
That's the bottom line.
Yeah, and the standard in the field, especially in the U.S., but a good part of Europe as well, has been, well, 6 months, get your dog in here to have it neutered or spayed. And knowing that the gonadal hormones have a lot of, you know, physiological effects, it's you know, throughout the body, it's important to kind of look at that. So and there was, you know, papers popping up here and there, showing, you know, increase in one cancer or another cancer, or knee problems, cranial cruciate ligament issues with neutering, but they didn't tell anything about the breed, or sometimes not even the sex and the age. So a practitioner couldn't use that information. So we launched a project, and we didn't know it was going to get so big, but we got we started with very popular breeds. Started with a golden retriever, Labrador retriever, German shepherd dog, and then we decided we better do the whole batch because they're all so different. The Labrador retriever is different than the golden retriever, and the German shepherd is different from that. And then, for example, the golden retriever, very vulnerable. The female is vulnerable to cancers with early or with spay neuter at any time, or spay. It's a female. That's one that's vulnerable. And then the German shepherd not, and the Labrador retriever not. So we better do a big sample of breeds. So that turned out to be a 10-year project. Fortunately, we had the American Kennel Club, Canine Health Foundation behind it, and we were able to wrap up the 10 breeds, including the 3 varieties of poodle, and publish that. So we were very happy to have that done.
With 35 breeds.
Yeah, 35 breeds. And then people would say to us, well, okay, when this work was going on, I got a mixed breed. What do I do? And we realized that most of the pet dogs are mixed breed. So we said, well, we'll have to do something. I don't expect there's going to be anything. My gosh, you know, mixed breed, but we'll give it a try. So we divided dogs into 5 weight categories, from very small to medium, large and then giant. And we found that the dogs in the 3 higher weight groups, from about 40 pounds or 20 kilos up, had an increase in joint disorders when they were neutered early. And that was different than the dogs that were smaller. So that is some guidelines. The cancers, which seem to be very breed specific in the 35 breed work, the cancers did not appear significantly increased in any of these in the mixed breed. So that's so then we finished that mixed breed, and so that's behind us now. We have to look what are we going to do next.
I'm sure you'll find something. And the amazing thing is, you've also got it by sex as well within the breed. So you've got, as I say, with the poodle, you've got the different sizes of poodles. So that's quite interesting because you can look within poodles, the different effects. You've got the differences, as I said, between the genders as well. And, I just recommend to anybody listening to this who's got a dog and is thinking about neutering, it's such an important thing. And, if you're a responsible owner, not only do you care about your animal, but you can control it, from unnecessary breeding. But have a look at this because, if you want to get the best out of your dog and minimize the risks, this is an absolutely phenomenal piece of work.
It's painful. Creating a cruciate problem or hip dysplasia, is expensive and it's painful for the dog, So unnecessarily increasing that risk is something we want to avoid. And also the same with cancers. There's some kind of lymphoma, for example, increased in risk in some breeds, not other breeds.
Yeah.
By early spay or neuter.
Yeah, and I've really got quite interested in chronic musculoskeletal problems because we started to look at our behavior cases, and now we're up to about 80% of the cases that we see in our behavior clinic have got some form of chronic pain. A lot of those are musculoskeletal. Yeah, and I've started to think about it in terms of the fact, well, dogs work incredibly hard to fit in with us. I was, and in the podcast with Ian, I was chatting about this. That's one of the things that really struck me is if you set things up, dogs will work to try and not cause problems. So if they're causing problems, it's because, it's not because they're spiteful or anything like that. It's just that they can't. The effort is too great for them. And in order for them to sort of fit in with us, they have to be able to predict us. That doesn't mean we have to be boring, but we do have to be predictable in our routines. And Lynette, we'll chat about this in relation to your human-animal interactions because, the way that people treat their pets sometimes can be really disruptive and confusing for the pet. And again, I'm aware of some of the work that you've done cross cultures, which again is so important that we don't just think that one country represents the whole world. your work on in Jamaica and places like that, the very different attitudes. But chronic pain's a big issue.
I'll put one more comment in here. When we first published the golden retriever study, increasing cancers and joint disorders in spay or neuter with the golden retriever, we got a lot of pushback. Oh my gosh, the veterinary profession, what are you doing? Leave us alone. We don't want to change. We've been saying this other thing for decades, and so we.
It was very uncomfortable sometimes speaking at veterinary conferens because we were getting so much real hostility. Actually,
one of the problems of being a pioneer.
The paper on the Labrador Retriever compared with the Golden, and then the German Shepherd, and then this one on 35 breeds, So that kind of pushback kind of died down. And we're right now being so bold as to say, we suggest a paradigm change in the veterinary profession so that spay and neuter become something that the veterinarian and the client sit down and talk about and give the client some say in what's going to go on. So the veterinarian isn't just telling what to do, but let's consult on this thing. We'll take the evidence-based information that's there and you can think about it and the choice is going to be yours. So that takes more time on the part of the pet owner, more time on the part of the veterinarian, but it helps establish their relationship early, because you know that's one of the first questions that comes up. So we are we sometimes under our breath, but sometimes out loud like this, you know, a paradigm shift in this space.
Absolutely. I think you're spot on. And again, you know, you always see these opportunities and the importance of this, that, you know, we're not there to dictate. It's like we published some work on client adherence to instructions in behavior problems. And initially we talked about it in terms of client compliance. And then as I started to read the literature, they realized that the term compliance has fallen out of favor, because it implies that you do what the surgeon tells you, or that sort of thing, that you just obey. And we're now in an information age, and people have got access to the information, and that's exactly what a professional should be able to do, because otherwise we're just going to be replaced by computers. You know, if it's just a question of this is what the rule is, tap, 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 boom, you do this. Whereas the real value of a profession is, or a professional, is that you can have a conversation with them. And surely that's going to make the job much more enjoyable for vets in practice as well, to actually chat to their clients. And as I said, that whole issue. The model
is human medicine, because if you have a serious problem in human medicine, cancer or something, you go to your physician and specialist, and they present a whole variety of options to you. There always are choices, and all of the choices are trade-offs. You may not have any wonderful choice, but you're trying to pick the best one of what's available.
Yeah, absolutely. And I think it's so important that we allow people to have that. You know, it's their pet, and they need to have ownership of the decisions they make. I think that's really important.